Hi, my name is Dr. Loh and I'm the fish vet. Today what we're presented with are some Frontosas that are having different problems in this 680 litre tank. What we're seeing here is that we've got multiple problems, starting with 2 fish presenting with dropsy in the last couple of months and dying. Right now we have 1 fish with dropsy, 1 fish with a cloudy eye, and 1 fish looks like it's got some sort of an intestinal polyp or some sort of a protrusion outside of its vent. One of the other conditions that the owner has a complaint about is that the fish are not growing. They seem to be sort of stagnating in their size despite giving them all the best foods. So the owner is feeding like 4 different kinds of food. So there's nothing really that you think about that would point towards nutritional deficiencies. And they're using all the newest foods available as well. This colony of Frontosas are wild caught individuals, so you never know what they might come in with. I guess they come from the wild, so they would most likely be carrying the regular pathogens in the system as they would in the wild. So what's really weird about this case is that all these conditions, they're just presenting with different conditions, and there's nothing similar about them at all. It's very confusing. So to start off with, we're just gonna do standard water quality testing. We've done water quality testing. Ammonia, nitrite and nitrate are all reading 0, pH about 8, KH or alkalinity 6 degrees, and the magnesium is nothing to worry about, sitting between 20 to 40 milligrams per litre. Okay, so the owner's caught out this Frontosa here. He's the one with the sort of growth or some outpouching from his vent. And having a closer look at him, let's have a look there. That looks like a piece of intestine that has sort of been strained and it's coming out. And it looks very swollen and a bit congested, so it's been hanging out for quite some time. What we hope to be able to do is we'll anesthetize him and then try and push that in and put a stay suture to keep that in, and we'll treat him with metronidazole for the hexamita, and hopefully that will all settle down and stay inside. All right, so what we've done is we've weighed this guy. It's about 300 grams, and we're going to give him metronidazole at a rate of 12 milligrams per kilogram body weight. The medicine comes in 5 milligrams per mil. It equates to about 0.72 mils that we're going to give him as an injection. So I just go central midline into his abdomen and sort of feel the change in resistance to the needle. And then because we're giving an intracellular injection, there's a lot of space there. There shouldn't be any resistance when you're giving the injection. I notice having a look down here, the gills actually are very pale, so it's very anemic. So I think he's probably not eaten in a while. So even though on the outside he looks to be very strong, he's probably only just hanging in there. Because he's quite anemic, probably giving some anabolic steroids. We've given that as well already, and just to reduce the inflammation from the intestine that's come out, we're giving it some anti-inflammatories as well. Let's see if we can reduce the intestine. That's one of the benefits of guess in a fish, is that they're in a watery environment, so if they've got any prolapse, it doesn't dry out. But the only bad thing about being in water is that it can actually swell up, which makes it a bit harder to replace. We've replaced the prolapsed intestine into his abdomen, and we're putting a purse string suture to reduce the size of the vent to prevent the intestine from popping back out. Why I've chosen to use a purse string suture is because it allows the hole to still be patent, so that the fish can still produce feces through the hole. And this whole procedure took me about 8 minutes, but to keep this video moving along, we're showing you only a few short clips. And if you're wanting to see the whole procedure in its entirety, we've included it at the end of this video for those who are interested. This fish, as you can see by the pale skin color and also the gills, tells you that he's really severely anemic, and we are gastric tubing him with some food to try and get his gut moving and to supply him with energy to recover. But this fish's chances of survival is very slim. So what we've done is we're going to wake him up from his anesthetic. We're just going to hold him near the water outlet from his anesthetic. I'm just going to get him to recover inside this net. And what we can see, this eye in the water was quite opaque, but outside you can see it's got sort of irregularity on the surface, so it looks more like traumatic damage than anything. So what we're going to do is we're going to give him an injection of anti-inflammatories, and if we just hold him upside down, and we're going to give that intramuscular, basically giving it at the base of the fin. That should help to settle down that inflamed eye. We've looked at the feces, and some of them look long and stringy, some with white membranous material inside. And so we're thinking there might be some sort of an enteric issue, maybe Hexamita or worm eggs or worms. So we've taken a sample and then placed it onto a glass slide. Now we're examining it down the microscope to look for any evidence of parasites. What you can see here is a fecal wet prep down the microscope. You can see 3 of these bugs sort of floating, sort of moving around, coming in and out of focus. There are at least 3 of them. These are also known as Hexamita or spironucleus, and these are the guys that are actually causing the big major problems in this fish tank. It's causing them the diarrhea, producing the weird looking feces, as well as probably causing the straining and the intestinal prolapse in the fish before. What we've found so far is the feces contains Hexamita bugs. So what we're going to treat them with is metronidazole. Now there are 2 kinds of metronidazole, and a lot of people are familiar with the tablet form of metronidazole. It does take some, it doesn't dissolve all that well in water, so it may not be as effective. Alternatively, there is metronidazole that is an injectable solution, which is water soluble. You can actually either add it to the tank to treat all the fish, or you can actually use it as an injectable, as an intracoelomic injection. To treat for the Hexamita, we're going to inject these fish individually with 12 milligrams per kilogram body weight of injectable metronidazole, as this will give very good efficacy, and we're following that up with in-water medication with the tablet version of metronidazole. We've calculated it's 720 liters, and we need to dose it with the metro tablets in the water at 10 milligrams per liter. That equates to about 36 tablets in total. So that's 21, 22, 23. So we've put 36 tablets into the bucket, allow it to sort of dissolve, and we're just gonna stir it up. And with this, we're going to add that to the tank. So just to sum up what the treatment plan is we've given them intracoelomic, which is intra-abdominal injections at 12 milligrams per kilogram for every fish every 7 days for a total of 4 treatments. And to the water, because if they're excreting the hexamita into the water, we're also adding metronidazole to the water with the tablets at 10 milligrams per liter of water. The tablets are 200 milligrams each, so that's about 36 tablets for this tank. And the owner is going to do a 50% water change in a week's time, and then we're going to re-dose the tank with another 10 milligrams per liter of metronidazole, and that should get rid of hexamita from the environment, and together with the weekly injections, that should eradicate the disease from this tank. While we're giving injections, we noticed that quite a few of them had pale gills. What pale gills means that it's got anemia, and that is potentially related to either having insufficient food or not absorbing the food properly from the hexamita. So while as part of the treatment plan, we're going to increase the amount of food that we give them so that it can help them repair and grow and flourish. To the food, we're also going to add multivitamins, which is going to help them with their healing process to boost their immune system. Now, being wild-caught individuals, they would be carrying parasites with them as they come into your aquarium systems. In the wild, in nature, they've got a lot of space where if they're carrying pathogens, they might excrete that into the environment, and that would sort of be dissipated and sort of, what's the word? Diluted. But in this case, because in captivity, most people keep their fish in recirculating systems. What can happen there is that even though the owner does weekly water changes, there are still the pathogens that can actually brew up in numbers, and they sort of amplify in the closed system, and that's how some fish can get sick from the parasites. Thank you for watching. Make sure you subscribe to get updates of our future videos, and have a fantastic week.